Welcome. In this video, we'll be diving deep into intestinal obstruction, a serious condition where the normal flow of intestinal contents is blocked. We'll explore the causes, symptoms, diagnosis, treatment, and more. Understanding this condition is crucial for both healthcare professionals and individuals who want to learn more about digestive health. So, what causes this blockage? Intestinal obstruction can arise from a variety of factors. Mechanical obstructions, the most common type, involve a physical barrier. These barriers include adhesions, which are scar tissues that form after surgery, hernias, where an organ protrudes through a weakened area, tumors, both cancerous and non-cancerous, volvulus, a twisting of the intestine, intussusception, where one part of the intestine slides into another, and impacted feces. Non-mechanical obstructions, also known as ileus, occur when the normal peristaltic movements of the intestine are disrupted. This can be caused by surgery, infections, certain medications, or electrolyte imbalances. Less common causes include inflammatory bowel diseases like Crohn's disease, vascular problems affecting blood supply to the intestine, and congenital abnormalities. Let's understand the progression of intestinal obstruction. When the intestine is blocked, fluids, gases, and digested food accumulate above the obstruction. This leads to distension of the intestinal wall. As the pressure builds, it can impair blood flow to the affected area, leading to ischemia or lack of oxygen. Prolonged ischemia can then lead to necrosis or tissue death and ultimately perforation, which is a hole in the intestinal wall. Perforation allows intestinal contents to leak into the abdominal cavity, causing peritonitis, a life-threatening infection. Furthermore, the buildup of pressure and fluids can lead to electrolyte imbalances, dehydration, and shock. Intestinal obstruction can affect anyone, but certain populations are at higher risk. People who have had previous abdominal surgeries are more prone to adhesions, increasing their risk. Infants and young children are susceptible to intussusception. Older adults are more likely to develop obstructions due to tumors or impacted feces. Individuals with inflammatory bowel disease or a history of hernias also have a higher risk. Statistics indicate that adhesions are the leading cause of small bowel obstruction, while colon cancer is a frequent cause of large bowel obstruction. While exact global figures are difficult to pin down, intestinal obstruction is a significant cause of hospital admissions worldwide, especially in emergency departments. The symptoms of intestinal obstruction can vary depending on the location and severity of the blockage. Common symptoms include abdominal pain, which can be crampy or constant, abdominal distension or bloating, nausea and vomiting, which can be bilious or greenish, yellow, if the obstruction is high in the small intestine, or fecal, smelling of feces, if the obstruction is lower down, constipation, or inability to pass stool or gas, and high-pitched bowel sounds early in the obstruction, followed by absent bowel sounds as the obstruction progresses. In severe cases, signs of dehydration, such as decreased urination, dizziness, and rapid heart rate, may be present. It's important to seek medical attention immediately if you experience any of these symptoms. Diagnosing intestinal obstruction involves a combination of physical examination, medical history, and imaging studies. During a physical exam, the doctor will listen for bowel sounds and check for abdominal tenderness and distension. A detailed medical history helps identify potential risk factors, such as previous surgeries or underlying medical conditions. Imaging studies are crucial for confirming the diagnosis and determining the location and cause of the obstruction. X-rays of the abdomen can reveal dilated loops of bowel and air fluid levels. CT scans are more detailed and can help identify specific causic tumors like hernias or adhesions. In some cases, a contrast enema may be used to visualize the large intestine. Intestinal obstructions can be broadly classified as either partial or complete. A partial obstruction allows some passage of intestinal contents, while a complete obstruction blocks the flow entirely. They can also be classified based on location: small bowel obstruction, which is more common, or large bowel obstruction. Another classification relates to the mechanism of obstruction: mechanical, involving a physical barrier, or non-mechanical, also known as ileus, due to impaired peristalsis. Understanding these classifications helps guide treatment strategies. Treatment for intestinal obstruction depends on the cause and severity of the blockage. Initial treatment often involves bowel rest, where the patient is NPO, meaning nothing by mouth. A nasogastric tube, or NG tube, may be inserted to decompress the stomach and relieve pressure. Intravenous fluids are administered to correct dehydration and electrolyte imbalances. In some cases, a partial obstruction may resolve with conservative management. However, complete obstructions usually require surgical intervention. Surgical options include lysis of adhesions, which involves cutting the scar tissue, hernia repair, tumor resection, or removal of the tumor, and in severe cases, bowel resection, which involves removing a portion of the intestine. Following surgery, patients require careful monitoring and supportive care. While not all intestinal obstructions are preventable, there are steps you can take to reduce your risk. Maintaining a healthy diet high in fiber can help prevent constipation and fecal impaction. Staying hydrated is also important for regular bowel function. Following post-operative instructions carefully can minimize the risk of adhesions. Regular exercise can promote bowel motility. And finally, early detection and treatment of underlying conditions, such as hernias or inflammatory bowel disease, can help prevent obstructions. The prognosis for intestinal obstruction depends on the underlying cause, the promptness of diagnosis, and the effectiveness of treatment. Early diagnosis and treatment generally lead to a good outcome. However, complications such as ischemia, necrosis, or peritonitis can significantly worsen the prognosis. Recent research is focusing on minimally invasive surgical techniques to reduce post-operative adhesions. Advances in imaging technology are allowing for earlier and more accurate diagnosis. Additionally, studies are investigating the use of medications to promote bowel motility and prevent ileus after surgery. These advances are continuously improving the management and outcomes for patients with intestinal obstruction.